Thursday, for example, I know Rudy raised the mental health response, and then the red flag, or the sorry, not red flag, the early warning systems for officers, and provided them the guidance that you all were looking for certain key elements, and they'll focus on those elements in their presentation. But frankly, the majority of what they intend to do is have you all interact and ask questions, and they can give you feedback on it. And as I alluded to in our last meeting, I'm more than happy to set up a follow-up with the law enforcement team to discuss the measures that they've already begun implementing as well. So with that, I won't take any further ado. I'll introduce the team from Alifa. I'll let them introduce themselves, but I'll just kick it over to David Douglas and Dr. Ashley Burns, who have been my principal contacts with Alifa. We've been working on this project for feels like in millennia now, but it's been, I've been really working with them since the middle of 2021, but they've been working with the county, a good 7 or 8 months prior to that. And so obviously it's been a long and windy road to get where we're at right now. And so I'll turn it over to them and just say thank you for all of their efforts in partnering with the county.
Thanks, Dr. Stoddard. Good evening, everyone. So I'm David Douglas. Ashley and I co-founded Alifa. Also with us on the call is Mitch Brown. Mitch is formerly the police chief for Raleigh, North Carolina, in addition to a whole host of other law enforcement credentials, but he's really recognized for being a progressive and forward-looking police chief. And he has really been one of the two people who have really overseen this project, along with Marianne Viverette. I think she could not be with us tonight, but she's the former police chief of Gaithersburg, so she's intimately familiar with practices in Montgomery County. And also on the call with us tonight is Jackie Proctor, who works with us and keeps all the parts moving smoothly. So we can do this in the way that makes the most sense for you. We can kind of walk you through sort of our main recommendations, findings and recommendations. We can sort of walk you through our executive summary, but I also don't want to just tell you things you've already read or seen. We do want to have plenty of time for questions, so we could do that section by section or save it to the end. So let me just start with first asking how you'd like to proceed, and also if there are any other general questions or comments that anyone wants to make before we start. But we're here to meet your needs, answer your questions. So tell us what works best for you all.
I think, Rudy, we should maybe kind of start with your two concerns that was expressed. Maybe if you can voice that, maybe we can start there and probably go around the table from there. The chair recognizes Rudy.
Sure. In the prior meeting, after reading through the audit of MCPD, some of the highlights alluded to the increase in use of force, particularly against Black and Latino residents, particularly in the Silver Spring and Wheaton area. Another highlight with an audit, this is actually one of your recommendations, was actually to bolster data systems that could perhaps be better at indicating early warning signs to really function as an intervention for officers who may be more liable to commit harms or compromise their position. Also, another thing that I raised, I actually asked Dr. Stoddard this question, and I know Kate had spoke to this as well, but about consensus among Montgomery County Police Departments as it pertains to crisis intervention teams versus non-police mental health response. So I'd be interested in hearing more of your thoughts on that. I know that there's data out there that shows that non-police mental health response can be more effective and more holistically based. But I'm really interested in seeing your presentation and how it may speak to that. But those are just a few of the points that I raised in the prior meeting concerning the audit.
Well, those are three pretty big meaty points, so there's a good place to start because we can talk about them a lot. So let's start with the issue of use of force, which really was one of the animating concerns in the county for this project, and it's very closely related to mental health crisis, that both generally, but because there have been a few specific incidents here that people have been concerned about. So let's start with use of force. It is clear that use of force and disproportionate use of force against Black and brown people in Montgomery County is a major concern. And it is something we looked at. But one of the key recommendations, this touches on one of your points, is data. The data here is not sufficiently robust to frankly give anyone, I think, a good handle on use of force generally, but also with respect to people of color. The same would be true of traffic stops. We we spoke to a lot of people. We looked at body worn camera videos. In terms of what we saw, we didn't see anything that would suggest bias, but I'm not saying that it doesn't exist. What I'm saying is, in the main, as is generally true, the vast majority of police encounters are very straightforward, and bias is a hard thing to find. So a lot of our recommendations are focused on improving the data platforms that MCPD uses, improving some of the training for using those systems, and also using those systems to promote public accountability. For example, we recommend reporting anonymized use of force data. So I think the first thing I would say in that area is it is a concern. It's an understandable concern, but currently the data systems aren't sufficient to really allow a robust or very precise analysis. And keep in mind, those things are tough because the demographic profile of Montgomery County shifts throughout the day, right? It's a majority minority county, but at any given moment, those numbers shift radically as people are, particularly with respect to traffic, right? And people driving through. So measuring this kind of stuff is a real challenge. And so one of our main focuses was on the data system that would improve both NOPD's ability to measure those kinds of disparities, but also to promote transparency to the public on those issues. But I'm going to stop on that to allow Mitch or Ashley to jump in.
Sure. Thank you for that question. And I guess what I would add to that is even though the report had to be organized topically, right, for the purposes of digesting the information, what's really important is that a lot of these recommendations go hand in hand and they intersect, and multiple things need to be done to address some of the core issues. So, for example, I think that the concern about whether there's disproportionate use of force of people of color or disparity in the incidence or the frequency of use of force geographically in the county, one good thing is, yes, that information was publicly reported, right? That was us getting that out of the MCPD's reporting, their annual reports. Chief Brown looked at their annual reports and kind of made some observations about the information. But like David said, one of our main concerns, or one of the areas we think that there could be significant improvement, has to do with reporting it at all levels. Right. So we think a best practice is having a better handle about what is, for example, some departments have 3 levels or 4 levels of use of force, from a head strike to cuffing someone to tasing someone to going hands on, to getting physical in any way, all the way up to lethal force. And when that is not clearly defined, it's very difficult to track. It's hard to have clear systems about how to evaluate those things independently and subjectively, right, at the same time and uniformly when they occur. And so that's why we have this fundamental, recommendation that there needs to be a clearer sense of when officers can use force, what that looks like, and how it can be done. And also, what's really important about having the levels of force is knowing how to scale it back, right? So, another thing we saw is that there needs to be more clarity about de escalation, right? Because if I'm not teaching you how to go from maybe raising my voice or giving a command to where I'm actually pulling my weapon on you or pointing my weapon at you or actually going to shoot or tase, right? Like these levels. How do I dial it back? If I'm just going to touch my gun, once I touch my gun, I'm going to draw my gun. If I draw my gun, I'm likely to shoot my gun. And so we believe that, in modern police departments, there needs to be much, much more guidance about all of the boundaries, right, that dictate using force and all of the tools that officers can use from their voice to their persona to scale it back because situations are very fluid. So that's one thing that's really important is that we believe that there needs to be more clarity about defining it. On the other side, like David said, we think that we could see more training in the department. We call it Chief Murphy on our team, who was the expert on that, talks about human relations training because the county is so diverse. And also, we know increasingly young people, and I hope this isn't taken in the wrong way, we're more on our phones, we're texting, so even just not skipping, teaching people how to speak to one another, how to say, hello, my name is Officer Burns. How are you today? How can I help you? Do you have a problem, right? Just engaging with people in a human way and not in some abrasive fashion. That's another part of our recommendations. Um, all the way down to having better systems to track use of force in the department, to tie it to policy changes and to tie it to improvements in training. And so this is one area where even a lot of the discussion is in use of force. It talks also to crisis response and to training and to management and accountability. And another layer, I would say the final layer on that has to do with supervision. When we watch body worn camera footage, one question we had to do with the amount of direct supervision in the field, right? So even if I commit something in policy or out of policy, how much accountability is there in the field on a day-to-day basis for any interaction with the public? And so Chief Brown may want to add to that, but I would say this is one that you've honed in on because it's really multifaceted and all of these things need to be improved in order to have better outcomes.
Well, Ashley, I think you and David have hit on all the key points that's surrounding the use of force and our review of that. One other thing I would like to throw in is that when we're talking about supervision, you're talking about when we start looking at the traffic stops as well, it's very difficult because of the lack of data to determine whether or not there are any biases in that area as well. But there are things that are available now, methods that are available now, and that can actually track those kinds of things. The technology is available. It's not impossible, so it's there. And the good thing is that MCPD is actually in line with an agreement with making sure that they get this the data processing in line so that they can actually present and do the in-depth analysis so they can present a clearer picture of whether or not there are biases or not, and also if there is a overabundance of use of forces, minor use of forces, and a minor would be something that's in a level 1 area that are disproportionate. So I'm sorry. Okay, but yes, training, is a key function. Supervision is a key part of it as well. That can reduce this and can identify, if you will, any type of areas, the types of areas that may be problematic when it comes to race and biases. So I think that's, I don't think we left out anything with what we are talking about here. It's all in the report.
Mitch, but one thing we should talk about, because it goes this, is about how uses of force are investigated. And do you want to sort of briefly review the current state and where we made findings and our recommendations to improve the consistency of the investigations of force investigations?
Well, yes.
Apologies. I had a brief question.
Oh,
I'm sorry. I know you invited us to ask questions.
Yes, sure. Go ahead.
And I just wanted to make sure that I was clear. Dr. Burns, I believe that you clarified a point that I was going to raise or ask about. You've stated that you didn't really have concrete enough evidence to show actual clear biases of officers regarding these traffic stops and use of force, excessive force, and in terms of whether they really are or there is a discriminatory application of use of force and stopping of persons of color. But the OLO's report, and yes, I know you're aware of that. Was that not some data that fed your analysis of, whether we can arrive at determining that there is actual concrete evidence of bias?
Yeah, thank you
Because
for that.
yes,
So the second report, I would say, was a big part of the Reimagining Public Safety Task Force group that was looking at use of force, that data. Our primary data set was coming from directly within MCPD, like trying to keep the two elements of the project separate. But I would clarify that I wouldn't say that we can't clearly identify, counts or frequency of proportions in absolute terms, right? I think we do have a sense of what that might look like for traffic and for use of force. But as far as the quality of those interactions, right, whether they were compliant with policy, whether they violated someone's constitutional rights, whether they were used safe and effectively, whether they were appropriate, that's difficult to determine because it's not being captured in a way that we believe reflects best practices. So I do want to clarify. I think that many in the county would feel straight up that yes, there is more use of force on people of color, lethal force and otherwise. But as far as the implications of it or how to actually critically analyze it, that is difficult because of the lack of descriptive information about the officers committing it, why they're committing it, what outcomes came out of it, who the subjects were, who was present on the scene, like all the conditions that were not met is unclear. Does that clarify a little bit
yes,
too? Okay.
yes,
Because
Dr.
I
Burns.
think most people would say
Yes.
definitely there is more force and more traffic stops on people of color.
We want to hear again, just raise your hand and we'll try to acknowledge you in between these points that are being made. Thank you again for your question, Rudy, and your follow-up, Alicia. And I think you were about to get into a second portion, but I wanted to make sure Kate's view was heard as well, which would probably segue right into what Mitch was about to go into. Kate, over.
Do you mean on the mental health side? Yeah. Yeah, I was.
I don't mean to, there was a question here from Mr. Landa about use of force reports filed for each incident. Can we talk a little bit more about that before we move to mental health? And that does go to what I was going to ask Mitch to talk
that's
about. Is can we do that? And then we'll.
Absolutely.
Okay. But I also know, Mr. Logan, I haven't gotten to, let me propose this, that we do Mitch. I did want to touch on early warning systems, but then his question was crisis intervention. So at that point, Ms. Manning, I'll come back to you and then we can start that discussion. Does that make sense? Mitch, do you want to talk about how use of force is investigated in the county? Because, and there's that question about filing of a use of force report for each incident, and there's a lot to this topic.
Well, yes. So when a use of force occurs, an officer is required to make a report on it, of course. And what happens is the report is reviewed by a supervisor. There were no indications at first, but I think it's been changed now, where a supervisor was required to actually review any of the body-worn cameras. There was no requirement there. Even going back up there were no requirements for some units to even have a body-worn camera that would give you a clear presentation, a representation or video, if you will, of what occurred during that stop. And in absence of that, then the supervision piece, which is paramount in any type of use of force investigation, it was kind of lacking. But I think that our recommendations that we've actually put into place, MCPD has actually has moved ahead with strengthening that and requiring that to do for supervisors to be present. And also for supervisors to be more involved in the investigation through a policy change. So it's a comprehensive approach that we took that the MCPD bought into as well, is that you just can't change one faction. You have to change several in order to get a complete view, a review or analysis of what actually happened in the use of force when the use of force occurred. And they didn't have that. Pieces were obviously missing. Now, the question about also de-escalation was not really part of the process, to where in essence you can actually, the first attempt is not to use force but to de-escalate before you get to that point of using force. There was no clarity in what level of force or the seriousness of a force, whether it was a death involved, or whether someone was struck with a handcuff, a canine deployment that ended in a bite. Typically is a level of force that's within that range of 1, 2, 3, and in some place sometimes 4. So, and each one of those levels require a certain unit, if you will, force investigative unit, where there was some serious use of force resulting in injury. You should have a specialty unit that will actually look at that and then do a complete comprehensive investigation of that force. And then the lesser uses of force are those that can be followed or handled by the district. That is, if someone complains of a use of force where, let's say you're tackling someone when you're actually trying to bring that person into custody, which is a use of force, no injuries, something that can be dealt at the district level. There was no clarity there as to who or what who should be doing those, and there was no really various oversight from the department on that. And so that's pretty much in place now, so that they have identified those levels, and the unit itself. I don't know whether it's coming to fruition yet, David, but I know that that's a recommendation to get a FIT unit there to actually conduct these investigations, and that's all FIT does. It's a well-trained unit, and they're called FIT, is Force Investigative Team, pretty much. That's a well-trained unit that's trained in looking at homicides, major assaults, serious uses of force, that they can actually do an analysis as to what actually transpired. Was it preventable? Did it violate policy? Is there any policy changes that we can put into effect that that may be obsolete, that may not have covered this particular incident? So it is a very comprehensive approach, if you will, to actually conducting complete investigations, and that was kind of lacking, which is serious in and of itself, because if you don't know, as they say, you don't know what you don't know. So if you don't know what's going on and you can't do the analysis, it's kind of hard to correct any problems that may be manifesting itself within the department. So you have to look inward, and you have to take a critical look at that to make sure that all aspects of that, including training, including supervision, and to see if something was astray here during this particular incident, and especially during serious use of force. So they weren't doing it, but now I believe they are doing it. So it's a significant change. But we talked about the data earlier and the technology, but you got to have that also to assist in identifying, if you will, any particulars within this construct. So it's very comprehensive to put together, and MCPD has put it together, the program together. And I think as we move forward, as you see, you're moving forward and utilizing this methodology, that you have more complete investigations. You'll be able to look at clearly as to whether or not this should have occurred, should not have occurred. If it did occur, hold officers accountable to that, holding supervisors accountable for their role in the lack of or not or participating in it. So it makes for a very good police department. I got to ramble a little bit, but
No. So let me, from this discussion, let me try and distill down, I think, the essence of the two pieces are. One, what is the current situation or problem, and what is the solution? And embedded in the questions, so we have the absolute numbers, and we know that for traffic stops, and I believe use of force, the majority are against people of color. So those are the absolute numbers. Then the next question is there a disparity? And I think the answer there is sort of yes on the absolute numbers relative to population, but that's not the simplest analysis because, as I say, the demographic profile of the county changes throughout the day and over time. What we're really trying to get to is bias. And the way we try and get to bias, we have a number of ways that we try and get to bias, and this is what our recommendation, or what we looked at, and what our recommendations reflect. So the first thing is we look at, are there biases in the policies? And we really didn't find any. Is there bias in the training? We didn't find anything in the training. We looked at how officers operate on the street by looking at body-worn cameras. 500, it's a lot, but not in the scheme of things. But we didn't see we didn't see signs of bias there. We frankly only saw a handful of instances where people were rude, but not enough to say it's bias against them. And so what I'm really getting at, though, is what we're really talking about, particularly here in Montgomery County, we're talking about implicit bias. We're talking about those things that are not apparent on the face, but that nevertheless result in different people being treated differently based on who they are. And so the way we try and address implicit bias is through supervision. We want to make sure supervisors are on the scene watching what's happening. We want to strengthen investigations. We want them to be consistent. We want them to be objective. We don't want this, we want them to be independent, and we want them to be documented and transparent so that later we can go back and look and see the different outcomes and see what happened in the dispositions. And that's a form of data. And then finally, we want robust data systems so that when we put all of those things together, where we're trying to get and what our recommendations lead to is having a robust data universe that allows us to compare interactions and identify like interactions and decide whether they have unlike outcomes. So in theory, and I'll talk about a test that is used. I don't want to get too far into it because it has some limitations or practical application, but it illustrates the point. There's a thing called a veil of darkness test that is used to try to assess whether traffic stops are disproportionately targeting a certain group of people. And the way it works, and I apologize, some of you may know this, so if I'm telling you things you know, I apologize, or I'll just put up your hands and say, stop. But in theory, you would look at traffic stops an hour before darkness, say sunset, and an hour after. And what you would look at is what's called the hit rate. So you'd look at the cars that are stopped an hour before sunset and an hour after, because presumably in the dark, you can't see the driver. Now that's imperfect because there's all sorts of ways you could make a guess about who the identity of a driver of a car, but that's the basic concept. And if what you find is that when you stop cars driven by people of color, to use this example, if you find fewer violations, in other words, you're stopping them, but they didn't commit a crime, it suggests you, in comparison to Caucasian drivers, it suggests to you that maybe the reason they're being stopped is not because of a legitimate suspicion, but because of race. I say that's an example when you have the right data systems that's the kind of analysis you can do to really get at. It does two things. It tells you whether you have a problem, but it is also gives you the tools to fix it. And those what our findings and recommendations are targeted to do to enable Montgomery County to do that analysis and take appropriate remedial action if necessary. Briefly on early warning systems, we love talking about early warning systems. These are really great for the community and great for the police. What they do is these are systems that we know, experts know, that frequently when you look at a bad police citizen encounter and or public, I shouldn't use the word citizen, but it's not really a good other word, but in any event, frequently, if you have an improper use of force or something else, when you look back at that officer's recent history, you find all sorts of flags that tell you this officer was on his or her way to having a problem. And so early warning systems take lots of data from things like complaints against an officer, even if they're unfounded, or uses of force, even if they're justified. And things like unexcused absences or professionalism complaints or excessive sick days or a whole range of things, and they digest them and you can look for patterns of behavior. And so the simplest, if you see an officer's been on the force 5 years, exemplary record, but suddenly they have a rise in unexcused absences and a couple of people complain that they were rude, it flags that. And it allows you to intervene, a supervisor to intervene early to try and figure out what's wrong. And if there's a need to do something to help that officer, be it training or counseling, I don't need to tell you all, suicide rates, alcoholism rates, divorce rates, substance abuse, off the charts for police officers. So early warning systems, and we can give you examples of how they've worked. Early warning systems save careers and save lives. It's important for you all to understand because it's important for the police to understand these are not intended to be disciplinary systems, right? They're intended to be just what they're described, just an early warning. There's something going on here and we want to know what it is before it's too late. So we are strong proponents of early warning systems, and I think the county's going to embark on that.
Dave.
Okay.
One thing I would add too is the great thing is they're comprehensive. like David said, they're good for the officer and the community because they also track the good things. So it's not meant to be a disciplinary system. It's not to be a aha catch you thing. The idea is to comprehensively keep track of someone's record. So it also would have something like awards in it. It would also have things like special training certifications in it. It would also have things like good supervisory feedback information. And so the idea is that it just works for everyone because it's just having a good, I keep using the word modern, right? A more professional system to keep track of your personnel. And like David said, the beauty of it is that there's technology available where they can build in the algorithms and they can build in the, the flags and personalize it to something the community wants and the officer wants. You can look at different departments and everyone's early warning, early intervention system might look different because you determine which track, you determine how much is enough to raise a red flag. But like David said, it's important because this also can stop things before they are really bad, but it also forces a department and it forces supervisors to adequately manage their subordinates, whether someone needs therapy, whether someone needs treatment, whether someone needs a pat on the back for doing a good job. It gives you all the data points, and it's something that's always comprehensively happening where it can either proactively flag an alert, or as a supervisor, you could run a report and say, I want to see how Mitch Brown's been doing. And it's something that also gives you a way to look at officers uniformly and without bias as well within your department, which is something that female officers, young officers, and officers of color also deal with as their employees, working within these organizations that sometimes don't reflect the community where people are policing.
And
Kate, I
Go
think,
ahead, Mitch. Oh, I'm sorry.
David, there's a hand up if they can get a question, and is that okay?
Sure.
Kate?
Thank you. Yes, it's very much in line with all of this, and I was really pleased to see in the report the information on wellness because, like you say, I think all of these issues are very closely tied with one another. So I have a couple of questions. One, just on this issue of the supervisors getting the early warning flags. Do they get training in how to reach out to the officers and how to have those conversations in a way that will lead officers to feel safe talking about challenges that they're facing? And then also, is there information, training, some kind of support around how to manage the stress of the moment when you're involved in a potential use of force, where we know that once you're in that kind of tense, elevated situation, you don't have your best decision making. It's really difficult to communicate well. So are they being taught how to manage the stress of that moment so that they can handle it in a calmer way? And as we were talking about earlier, focus on de-escalation.
So I think, oh, sorry. Do you want to go first, Mitch?
No, go ahead, Ashley.
I think there's two things on this one. On the first question, the great thing is this is something that a department can personalize. So you can have an early warning and early intervention policy that dictates what the alerts are, what's tracked, what triggers an alert, what happens when there is an alert. You can have it where you're personalizing who has access to the information, right? Because the confidentiality of it is really important. So just because there is an alert, it can determine who gets the flag for certain things. It may not be appropriate, right? For the next supervisor, it may need to go to a captain or a commander. And so all of those things you can actually make for your department, and it doesn't have to reflect what the DC police is doing or any other agency. It's about what you think your officers want and need, but we would recommend it being completely embedded in a publicly available and well-vetted policy so that it is applied uniformly. On the teaching front, what's really important is moving officers to a more kind of collegiate, professional university style learning academy. There's been a lot of talk nationally about moving from a warrior to a guardian mindset. And so I say that because, again, it's also the quality of the instruction and what's being taught, having more adult-based learning, having more scenario-based training, moving away from simply sitting in a static classroom with a PowerPoint slide and moving to kind of more realistically scenarios where people are actually engaging in problem solving and having to figure out how to work a situation where maybe 10 recruits are going to go through that differently, but ideally they all choose the right manner of approach, and we have favorable outcomes. And I say that because, for example, we were recently looking at another agency, and they had scenario-based training, for example, but in the 3 scenarios we observed live, they all ended up in really excessive use of force, even the failure to comply one. And this didn't happen at Montgomery County Police Department. Chief Murphy spent a lot of time on the ground. He observed the instructions. He talked to the teachers. He sat in classes, like in person, not virtually. But some departments, you could say, oh, well, we have, scenario-based training. But if every scenario ends in shooting someone, even for a traffic stop, or even because you told them to put their phone down, that's concerning. And so it really is important to look at what is being taught, what are the principles, who's teaching it, how is it being graded, how is it being retained, what refresher training is being given, but also making sure that it's aligning with local and state law and best practices and community informed, right? So you want to have a really dynamic learning environment, not only for your recruits, but also for your ongoing professional development and in service as one goes from being a recruit to being in field training to becoming a police officer, all the way up the chain of their career as an officer.
In terms specifically about training
I was about to
for
ask
how supervisors would respond, yes, that should be part of that system for how you intervene, if you will. And then I just wanted to say on the stress management piece, broadly, there's 2 pieces. One, Ashley talked about a lot of training, right? Is about slowing down the scene and rehearsing so that it's more, it's less stressful and you learn to manage that. But we do make a recommendation that there be a comprehensive assessment of the officer wellness program. So some of stress management is managing how to manage the stress of an encounter, but some of it is sort of just how to mental health wellness generally. I'm sorry, Bishop Walker.
Is that when we say again the mental health and wellness and the training and the supervision? One thing that kind of stuck with me, David, when you were saying that drugs and alcohol was off the charts in reference to law enforcement and officers. So my question is, with that being said, if it's off the chart with the wellness in mind, then how is that being addressed then? Because that all plays into how things are escalated quickly because of the mood and the emotions and the psyche of an officer who's dealing with these type of addictions. So is that something that's periodically implemented by the supervisor? What is that? What did you see in that in reference to that? Oh,
Well, Mitch, were you going to say something?
No, but I can respond to that. I think typically though, what happens is during the counseling session between the officer and the supervisor is that a determination is made at some point during that counseling session, or should I say intervention, that a person is suffering from some sort of drug-induced symptoms. Then the next step is to, again, recommend or assign that individual to your departmental psychologist or to a medical physician, if you will, to deal with that problem. You take them out of service. So as was asked earlier about, is it a training provided? Yes, all of that training from the supervisors is a must, and it has to. They must understand the ramifications of not identifying problems and how it will affect the officer life or death situation, and how it's going to affect the entire department. So typically at a collegiate level, you'll have the instructors that are PhDs that will be talking to the supervisors, if you will, during this training and giving them the proper instructions on how to recognize various symptoms. And if there's ever any doubt as to whether or not there is a problem with one of the officers, then they err on the side of caution and recommend that officer for further follow-up through one of the medical professionals. So, and the policy has to be, it should be written like that, that is solely based upon, the sergeants being accountable to sergeants, supervisors being accountable to recognizing these types of issues that's coming from the workforce, and to be able to recommend them to further, if you will, evaluations.
And part of that, I
Let-
think,
let-
too, is like making sure that, you know, the fit for duty policy is comprehensive and ties to other tools and elements in the department. And honestly, I think that you're raising something that's going to increasingly be a concern on the recruitment side of the house. You know, as marijuana, for example, is being increasingly liberalized across the U.S., there's many departments who are dropping some of the restrictions on use of substances, which for people who are Black and brown and of all other types of backgrounds, it can be really scary to think of someone having a gun and having the power to use it, who may not be completely coherent, cogent, or clear in a moment if that's not something that's vigilantly supervised and observed. And I think that you're raising something that's bigger than MCPD. I think it's something that we're going to continue to face as departments are loosening hiring and recruiting standards in efforts to encourage more people to join law enforcement. But I think that that's also why certain elements of our community are asking for alternatives to force. You know, there are people now asking, you know, can we have public safety and law enforcement without guns all the time, or without tasers, or without sticks to beat us? Can we find a way to manage ourselves as a human race without the idea that, you know, the typical reaction might require a weapon? What if we move to a society where the typical reaction does not require a weapon? There's places in other countries where officers don't have guns. You know, that's a thing. It's just, it sounds unique to us, but, and I'm not advocating, I know this is recorded, so let me be clear. I'm not advocating for anything specific other than there is a way in which public safety and law enforcement will have to transform to stay with the current needs and the demands of the various communities that we have in our country. And so if a community wants to loosen hiring requirements or recruiting in order to have a more representative department, whatever that means, or a more accessible department, whatever that means, we have to also have the tools for effective accountability and supervision and tracking and management of whatever we choose, and also know that there's the freedom to continue to evolve. You can change something and then change it back. You can do something, track it, look at the outcomes, look at the data, see how it's going, and try something else. So we're not stuck with any one thing. But I think for the issue of officer wellness, this is one where we see across the country far too resources are dedicated to something that's so important. And there's some agencies that, you know, if you're involved in a shooting or if you're involved in a lethal force, you are required to get psychiatric care or medical care within 24 hours, for example, and it's non-voluntary, it's automatic. And that person has to talk to you, wait a few days, and talk to you again to determine whether you can go back to work. Other agencies, if you're shot on duty, if you're injured on duty, if you have a domestic dispute with a child or a family member, right? But part of it is realizing that this stuff is real and not just kind of turning a blind eye, but making sure that the resources and tools are there. We had a really unfortunate event recently in another department where an officer committed suicide. You know, there's a high rate of suicide within, you know, law enforcement and public safety. And it makes you wonder whether we did that person's family and children justice by knowing that they're in such a stressful job right now. And if there's something that could have been done, you know, were there things in the early warning and intervention system? Were there things that the friends and supervisors found and it was too late? But once it happened, a whole bunch of people stepped out and said, hey, we were concerned. We had concerns. And so all of this kind of, I'm sorry if I'm not being succinct, but I think that this is a really important issue because this is a challenging job. And I think sometimes we spend a lot of time on the community side and we don't think about everyone involved and the people who are really choosing to protect and serve and to do a difficult job, but may not be getting access to the resources they need, whether it's proactive, but things that are just available to me without me having to know that I need help or assistance and having to go look for it.
I did, in the spirit of this being recorded, I said off the charts. It's because I don't have the statistics at hand. What I should say is all those rates are high for police relative to other professions. But more importantly, I don't want to create the impression that it's a massive problem in the Montgomery County Police Department. We're really talking about a relatively small handful of officers, but these are serious problems that hurt the officers and hurt the public. And so in terms of how we address that, the first is, Ashley and Mitch was saying, we train people to watch for those signs. But the second is this early warning systems. We use the data to look for the signs of stress. And then, of course, there's officer wellness programs and peer counselors so that officers know they have a place to go. And the last thing I wanted to mention on this point is another recommendation we make is that Montgomery County participate in the active bystander for law enforcement program. I think you all have probably heard of it. If not, someone put it in the chat and I'm happy to talk about it, but essentially it teaches officers how to intervene. They all have a duty to intervene, but social science tells us that people don't intervene. There are all these powerful inhibitors. And so the active bystandership for law enforcement program called ABLE teaches officers how to intervene to prevent, to spot a problem or to prevent a problem.
I think there's two questions as well, David. I think it's George and Christopher. So we can go in that order. I think their questions may be on the line of this topic currently. George and
Thank you, Bishop.
and I think, Kate, your hand is still up, or is that from the last question? Okay, so we can go George first and then Christopher. Sorry, over.
Yeah, thank you again. I appreciate the time that you've taken, both in writing the report, which is full of great detail, but also in your time tonight to debrief with us here. I want to try to take a bit of a step back, if possible. We've talked a little bit about the different areas and different recommendations that you've provided for law enforcement here. And I just wanted to ask, given constraints. And the multitude of things that can be done, I understand that these are all sort of interrelated, and perhaps interrelated, is how it would work best. But I wonder if there are specific recommendations that you would weigh more heavily than others. Are there things? Could we talk a little bit about if this is the case? I have two questions, so indulge me if you may. That's the first is what is the most pressing priority if you were to say, as it relates to the recommendations that you've issued?
So I'll give you mine, and then Ashley and Mitch can give you theirs if they're different. Although there's a chance that I end up saying all of them. But I'm going to start with data, because the key is, in terms of structural reform, the data platform, I think, is key. The second, because it's such a concern in this community, is mental health crisis response. And the short answer there is the problem here is not lack of resources, it's lack of coordination, and that the various parts of the ecosystem are not working well, and that's being addressed. So I would say that mental health crisis response is the most important, because that's where we see use of force disproportionately being problematic. And of course, then that leads me to use of force. And not the use of force itself as much as how use of force is tracked and managed, including supervision and investigation. So I think I've covered at least half of the report in that, but Ashley or Mitch, do you have a different ranking?
Sure. And one thing I would say, George, is I would answer the question in saying that I would say that we believe that they're all a priority. So one thing we worked on is we spent a lot of time, even though the report is long, And even though there are a lot of recommendations, and maybe when I finish, Dr. Stoddard might want to speak to this. I mean, the county is, between the county and the implementation committee and the MCPD, they are working on implementing 200 recommendations from the Reimagining Public Safety Task Force report, as well as our report. And so the thing is in order for the county to get what it wants and what the community is demanding, it's really going to take doing all of this. And so, you know, where it comes down to priorities is like what's going to get finished this year or next year or in year 3. But our understanding is that the county is really committed to this. So before we put that report out, what added to the time of this project is we did speak with the union. We spoke with the department. We spoke with officers. We spoke with the Imagining Task Force. We talked with the civilian union. I mean, we couldn't talk to everybody because it's such a huge county, but that's also why we hurry up and we got that preliminary report out last June, right? Just so people could see what's out there so that they could speak up and say things. And so folks met with us. They wrote us letters. There were meetings within the department. Back in April, we even had a couple of forums where the department worked with our community organizer, and they went out to a couple of schools and talked to the youth to hear what kids in the county think. So, I mean, unfortunately, we had limited resources, but the things in the report really reflect what we thought were feasible and reasonable and doable, right? And if there was something that seemed insurmountable, we had discussions before the report came out. And so that's why we think that what the county has accomplished is kind of a national best practice and transformative, because when the report came out, you had council members, you had your police department, you had your union, you have your county executive, you have people from the community, people from your task force all coming together to say, look, this is what must be done. And I don't think there was ever any sense that we could pick and choose or that anyone was planning to. So I don't know if that effectively answers your question, because I'm echoing David in the mental health crisis response, the use of force, the data collection. But we truly believe that for a comprehensive review and to bring the reimagining that has been demanded by the community, right, especially since the task force project went first. And the idea was that the task force work would inform the audit. The audit didn't happen before the task force work, and the task force did an incredible amount of work and met almost weekly for months and months and months to look at the ecosystem and many of these issues. And so that is a long way of saying that we really believe that all of this is important. The county has a website that they're going to be building out that shows all 200 recommendations and where the progress is and what's going on and who's working on each one. And they're really committed to this being and continuing to be a really transparent process. So Dr. Stoddard, I didn't want to speak for you, but I worry that you would say many of these things are very important, even if not equally, but they're mostly all priorities.
Yeah, the only thing I would say is obviously there's some, when we talk about like the boots on operating on the ground, for example, replacing the data management system is going to be probably like a multi-year process from buying the system and integrating data, right? It just takes time. So while that's happening in the background, then you work on the shorter term things that you can do more immediately. And so the intention is to, I don't want to say do literally everything, but if we choose not to do something, we'll explain why we choose not to do something, or if we choose to do something in a slightly different way than was suggested, we'll describe that. But I think the intention is we're gonna have 200 recommendations that are gonna have an answer to them in some form or fashion over the next, few years. And obviously some of the things, I think the resourcing around mental health is an example. Yes, we need to coordinate better, but frankly, we have 3 mental health response teams in Health and Human Services. We probably need to have like 8, according to a report we had done in the mental health side. And we've got to get more bodies in the door who are social workers, therapists, peer support specialists, and otherwise. And that's a tough market right now. And so, there are things that are going to be done in the short term because there are policy changes like use of force. We've already begun drafting, for example, the different categories of use of force and defining who's going to investigate those things. I would expect, and don't hold me to this because I think, things happen. I think we're likely to make the use of force policy change over the next 3, 4, 5 months, and so I think that those things are going to happen very quickly relative to other things, but I think there is an effort to do everything. So
Yeah.
I'll stop there.
Thank you for the comments there. I'll just, in the light of time, want to give my colleagues an opportunity as well, and I'll ask my second question briefly. But that's what I'm trying to get at is certainly I understand that these are all important. There are sort of institutional changes that are required, cultural changes that are required, like Dr. Tarter was saying, changes in terms of policy, long versus short versus medium term kinds of changes. And so I do agree that, the data as it relates to the Police Accountability Board, and I think this is a priority for me and should be for the board as well, right? Understanding trends, understanding how over time, interactions with the community occur, how they occur. And so I think that's certainly important. And so I agree, and I appreciate the context there. Just again, just for my second brief question is, as it relates to that data, well, was there any effort on your team's or on behalf of your team, was there any effort to obtain, and this is perhaps again another item for the Police Accountability Board itself, but the complaints and the extent to which an analysis of complaints across time, was that something that was entertained or possible?
We did not do a comprehensive analysis of complaints over time. It's just outside the scope of what we could.
Okay,
could do.
Understood.
Resource intensive.
Thank you very much.
Going back quickly to the early intervention system, could you, I have 3 quick points. Could you maybe share with us the number of officers who triggered intervention since the policy was established? So is that a big number? Is that a small number? The number of officers who triggered repeat warnings, is that a big number? Is that a small number? And then what that data tells you about the sufficiency of the policy.
So the data system doesn't exist yet. Ashley or Mitch may be able to help me out. There is someone who tracks this, but it's
In their
just,
head.
right, it's just sort of in their head. So we don't have that data, and that's not a good way to do it. I mean, it's better than nothing, right? But
Right. So if I make a comment here real quickly. So when I asked that question of a manager of how do they track these events in office needing assistance, basically I was told, well, I remember they come across my desk, so I remember all of them. Well, obviously, and the way he framed it was that the more to come across it, the more I can remember of their which officers are need some help. Well, that's on the end of the spectrum. The problem has already existed. An early warning system obviously is something to prevent that from even happening, so you will not have those their names coming across your desk as a result of a use of force. But I certainly agree with David and Ashley. I think that they're all pretty much equal as it relates to the importance. If you take training out, which you can't do, I mean, because you have to have that type of training, and you have a robust training program. You have to have good policies. You have to have early warning systems. If you don't have that, you have to have a good investigatory unit that can deal with it. You got to have good data and a good technology to get that information so that you can do a complete analysis. So, and I understand the budgetary constraints. I understand that, and trying to prioritize it, what's 1, 2, 3, or 4. It's commendable again that the county is saying we need all of this, and it's just a matter of time and getting all of it in place, which is I think is a major step forward, accepting that in general. So yeah, I agree with everything that my colleagues have said here, so forth.
And then I could see it's not in place. So would it really look like at the time of the audit? And remember now, as each month goes by, we're getting further and further. So what it ultimately looked like is, I think it's policy 306. And basically the trigger was if an officer had 3 complaints in a 12-month time span, going across their supervisor's desk. That's kind of what was described to us. And then what the policy provided for was some guidance on what that supervisor might do in the instance of that. And so that is that we recommend something that is really nothing like that. But that is, to answer your question, what was in place at the time of the audit. And that's why Chief McNeely, former chief of Pittsburgh, that's why he spent so much time actually trying to go into detail of like, this is what this should look like. And so we kind of get a little bit in the weeds in that section, but it's because it's like, wait, you need some more information from scratch. And so that's why you see a little bit more detail there, because what they had in place was really so far from what we thought would be best for the county.
Thank you.
I'm sorry, David. You guys can continue. I didn't see any other hands raised.
So I think the only thing we haven't covered so far from the beginning was about the non-police crisis response. And so David's going to talk about that a little bit, but I wanted to make sure we're aware that when we did the review of the MCPD, our scope was to a review of the MCPD. And so we really first wanted to see what the crisis intervention program and training and operation looked like within the department. And we have some very specific recommendations for what a more robust and formal CIT program will look like in the department, the type that we see in other places, so that, for example, when there is a call for service, there's a higher chance that you will get an officer responding who is well versed in this or specializes in dealing with it in the first place, because you don't have that right now. And so Julie Solomon, who's our expert, she has this national best practice expertise in really comprehensive county-based crisis intervention programs and the ecosystem, because that's her field of expertise, is the entire ecosystem. And so it was important for her to comment on that. And there's a lot more that she had that didn't make it in the final report because it was technically not the MCPD audit. And so I just wanted to start before we go too far down the whole, that we don't have Dr. Santiago on this call. We don't have Julie on the call. And so there's a lot of other elements that are outside of what Chief Jones and the department, have jurisdiction and full control over, even though they're working really closely and collaboratively on these ecosystem-wide issues. So I just wanted to say that so that we don't go too far into things that have a lot of other agencies and people involved in them at this time and at the time of the audit.
Rudy, did your question, is it still on the line of what we just talked about before they launch?
I just wanted to add a caveat to what I articulated earlier. I don't think I said it clearly enough. And it's not to minimize the positive effects that crisis intervention training can have within law enforcement, but to my understanding, there's a growing number of law enforcement personnel that are interested in either reducing their involvement or removing their involvement from mental health response. So I'm wondering, like, in light of this, growing, thought, what factor did this play in making recommendations to, I guess, enhance the process of crisis intervention training versus non-police mental health response, and also the county's plans to cultivate their mobile crisis response units?
Thanks. So the first really amazing thing is that a great crisis intervention training program also kind of recognizes that. So it would, for example, promote a base level of training for all officers or for a high proportion of officers in the department. But as far as the advanced skills of being on the team, there would be some proactive select into it, right? So officers who want to do this, and the officers who tend to want to do this is because they have a child or they have a family member or they have education or they have interest or they have a passion for the work. And that can make all the difference in the world. And so those officers are the ones that go on to do advanced training and they continue to get professional development in it, right? But we believe that that is important. This very, Julie would call it a bumped up response, but also still making sure that all officers have a basic training. And so what that looks like, for example, when you're on a scene that's a classic CIT type of prototype. For example, let's say there's a scene and there's two people and someone may be having an episode. What that might look like is that everything is dealt with completely differently on that call for service, right? It is coded as such, it is dispatched as such, and it's treated as such, with an outcome being, right, that this person is going to have agency to go to get medical care. It's not really intended to end up in an arrest or going to jail or something like that. It's super complicated because a lot of times on these calls for service, it could be a mother or a son or a friend. It's someone who sometimes knows the person who's calling for help, right? And so you may have an officer staying with that person, and that person is trained to stay with that person, keep that person calm, be attentive to that person. If there is a victim, there's another officer who is staying with the victim and only dealing with the victim. And then you may have one or two other officers if there's other people around, or let's say it's a family gathering that kind of gets escalated, and they're dealing with everyone else. And so the whole scene management, it looks different. It's dispatched different. It's treated differently. The way that you talk, knowing to keep space, knowing to not, raise your voice, not to touch your weapon. So it's really, I'm saying this with such passion because I've been on a lot of CIT scenes, even for my own family members here in New Orleans, and it's very different when you have a good program in place. And we think that the county should really also focus on getting something that looks more like that, and not just saying, oh, I'm CIT certified, but I don't have the training records. It's not really kept track of. And then unfortunately, at the time of our audit, most calls that may involve crisis, you don't have a way of, dispatch didn't even have a list of CIT trained officers. It wasn't even up to date. So the likelihood that you're getting someone, to your point, who wants to do it, as opposed to they have to do it and they know how to do it, it was pretty slim based on the existing structure that was in place at the time.
So if we're talking about a non-police response, it requires a fairly robust, comprehensive network. The statistics tell us that individuals in mental health crisis are less likely to be violent than others, or but there's a misperception that they're more likely to be violent. And it's certainly true that many of these calls start with a call about potential violence. And so some calls may require a police response. There's a risk of violence. The challenge, and what you would need to build out, is a comprehensive response system that starts at dispatch, that knows how to get the right information. Ideally, you would know enough about a person. If this is my son and he's never been violent, but he needs help or some support or attention, in theory, that should be communicated to dispatch. At some point, someone can say, we don't need police for this one. We know what's going on. Right. But there are going to be some where someone's walking down the street with a knife or threatening to kill. That, and these things can go badly quickly, and they're not one-dimensional. A domestic violence call can have a mental alert. So the short answer is there's certainly a room for a non-police response, but to make it work, it has to be part of sort of a comprehensive structure. And I guess I should also say there's some varying opinions on how these things should work. I don't know that there's one sort of best practice. Things work differently in different communities. But there is certainly benefit to having a non-police response capability.
Dr. Stoddard?
Yeah, the one thing I wanted to add, and I think the key to this is, as much as police want to reduce their footprint within the space, they still have the legal responsibility under state law around the emergency petitions. There is no other, you cannot enforce an emergency petition, which frankly a petitioner regularly, but not always, is a parent seeking a petition for a potentially suicidal youngster, and they go to the court and get this petition. the only people who can transport them legally are police officers. And I realize that's potentially problematic for, this, can obviously cause trauma to a teenager who is by the court's definition already traumatized. But there is no other person who can conduct a transport under state law, because you're essentially you're sort of basically arresting them for all intents and purposes. And so there is always going to have to be a space for police officers involved in mental health response. They, number one, need to be trained, and we agree with everything that Alifa has made statements on in this area with regard to tracking it, training on it. A one-time 40-hour training is insufficient if you've been an officer for 5, 10, 15 years. So you need to have refreshers and a regular continuing education, because the space evolves. We learn more things about how to deal with people who are in mental health crisis. And so I think the key thing here is there's always going to, at least as long as the law exists as it is, there's always be a space for law enforcement in mental health. But I think depressing that footprint is a good thing. Having officers who are better qualified to be in the space when they have to be is a good thing. And then obviously having the data records on how it's going. I will tell you, I did a ride along this past weekend, and I won't betray any confidence in the way I describe this. They had a situation essentially where there was an emergency petition for a young person. The young person, even when they had the civilian responders out with them, they were not going to go willingly. And the police are literally agonizing over on the radio on how they do this without getting themselves into a mess with the use of force. And this was probably a 20-minute debate over how best to enact this. And so I think there is real understanding from the police department's perspective that they've got some difficult decisions to make, and there's some reticence to be really in this space, knowing that they're not, it comes with a lot of potential risks in law enforcement and to the person that they're working with. But because the law exists the way it does now, their options are more limited. So I'll stop there.
David, Ashley, Mitch.
I would only just before we continue, it's 8:20. Out of respect for our guests, I would encourage, if there are any additional questions, I would want to make sure that we get to those and try and have them done along the scheduled time is a humbly request of the board, so that they can enjoy their evenings as well.
I wasn't sure. I was hearing what Bishop Walker.
I'm sorry. Yeah. Any other hands raised? So we give that up. We just saw a hand here. I have a hand here. Let's see who that is. It's Alicia again. Alicia has a follow-up question. Go ahead, Alicia.
Yes, I'm sorry. It's just a brief question, and thank you so much for the information you've shared with us. It's a very brief question, and I just would like you to expound upon or give some information regarding any disparity, or let me correct that. How promotion and discipline is meted out among the officers, and my interest is whether there is any disparity as to how that is administered among the officers, white officers, officers of color, female officers versus male officers, and so forth. Whether that was part of your analysis at all, and I apologize if I overlooked that in your report. And if it was not, do you have any information for us or any research that you've done regarding that?
It was not within the scope of our review. Mitch, I don't know if there's any, I'm reluctant to make any observations that weren't formally within the scope of our, I think the answer is not something that we looked at.
Right, that's correct.
Thank you.
Okay, we're just waiting to see if there are any other questions or comments. I know we're moving late into the evening. If there's no other comments or questions, we will leave it up to Alifa to have the last closing words. David, Alicia, and Mitch.
I'll just say on our behalf that this was a real privilege. It was really a joy working with everyone we worked with on this. We believe that what Montgomery County did is going to serve as a model for the nation. In fact, we'll be sponsoring a police reform conference in the fall that's really focused on the public's role and how the public can take charge and have agency in driving police reform. So I think you'll all probably get invitations to that, but I say it to say we think that this project will be one that will be featured because this was in so many ways proof of the concept that was underlying the foundation of Alifa, that if we can educate the public about what good policing looks like, we can empower them to drive change. And that's really exactly what we've seen here, starting from the task force through working with the department, through the way the department and the county have embraced these changes. So this has been an extraordinary experience for us. So we thank you for trusting us to help you with this.
Oh, well, I'm sorry. Thank you so much again. It was a pleasure. I counted a privilege to have worked on this reimagining force. One of the things we did was, of course, to jail and arrest that we worked on. So thank you so much for the report and your time. Again, any last alibis or final questions? I think Alicia's hand is still up from previous, so if that's so.
Yes, no questions. Sorry.
Okay. Thank you again for your time to meet with us and to answer our concerns and questions. I think it has really moved us forward in what we as the PAB are wanting to do for our stakeholders. And we look forward to those invites to the conference. Thank you again so much, Mitch, Ashley, and David. Thank you so much. Everyone that visited us and tonight, all of you, thank you so much.
Good night, everyone. Thank you.
Enjoy
night,
your
everyone.
Good
Enjoy
night.
the
Thank
discussion.
you. Good night.
Very much.